Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman here, broadcasting, of course, from remote, the garden level at the Holman House. Right now, though, we're gonna run down to Dearborn, Michigan, and Cleamon Moorer is the president and CEO of American Advantage Home Care in Dearborn, and we're happy to bring him on. Cleamon, it's always good to see you. How you doing?
I'm doing great, Chris. Great to see you as usual.
You know, the last time I think I saw you, we were shaking hands and we were giving you the Michigan 50 Companies to Watch designation.
Absolutely. Back in May of this year. Absolutely. What an honor that was, Chris.
Well, yeah, well deserved. And trust me, you do not get that unless you deserve it because it's a very rigorous competition. So,
Yes, sir.
all right, now listen, I got a big question here with a little background. First of all, you're CEO, rapidly growing home health care agency in southeastern Michigan.
Yes, sir.
You have 5 higher education accomplishments, including a doctorate in business administration, and recently earned the certificate in business excellence for health professionals. And for the past 20 years, you've
Yes.
been the professor in the classroom, while at times also chair of the business or health departments for colleges and universities. You are going back to college as a student. Help me with that, Clem.
Absolutely, Chris. Yes, sir. So you nailed it, Chris. So being an entrepreneur, you have to continuously learn, right? And not only be a good learner and a good student, but you have to have the ability to teach, teach your employees better ways and better methods, as well as teach your customers or your stakeholders. And our primary stakeholder in healthcare are patients, right? So teaching people about health and wellness and making better choices and better decisions would be incomplete, Chris, in my opinion, without having some type of clinical background, some type of knowledge as a registered nurse or as a therapist. It really, really helps to drive home some of those health and wellness points for
So,
patients.
so it just occurred to me, Clem, they're going to have to call you Dr. Nurse.
Doctor, I know, right? Exactly.
That's a little confusing. Hey, when did you actually start thinking about becoming a nurse? And I reflect back, I always wanted to be a teacher and a coach
Yes.
from a very young age, and I did that
Mhm.
for 10 years. When did
Yeah.
this occur to you?
Well, Chris, it was a few years ago. I think once you get into those 40s, some folks call it midlife or midlife crisis, but you know how you spent the first 40 plus years of your life or 20 plus years of work. You know how that's been spent. And then you may want to scratch your head and determine how best to spend the next 20, 25 to 30 years of your working days. Can you have a greater impact? Can you build upon your legacy? Can you diversify skill sets and try something altogether new and jump into a lake of vulnerabilities and unknowns so that you could, ultimately be your best self and deliver better value to others?
You know, I think you and I share a character flaw too, and that is
Yeah.
that we always have to have something new in every
Yes.
day.
You know it. Absolutely. It's a new day. All bets are off about what happened yesterday. It's a whole new day. And how do you make it better, Chris? How do you be more? How do you do more? And how do you give more? Because life is a gift, man, and we have to keep on giving and
No, it,
learning.
it it absolutely is. You're right, and I do suffer from that. I totally understand where you come from. Listen, while you're with us, I wanted to ask you about home health care,
Yes.
especially because so many of people, really in my age demographic, are starting to look at that decision as not too far in the future.
True, true. And I think the pandemic really highlighted and emphasized, Chris, the need for healthcare inside the home. How do we prepare seniors to age in place where you maintain your dignity, right? The familiarity of your family and home environment helps to fight against some of that early onset of Alzheimer's and dementia.
Yeah, no, you're
Yeah.
absolutely right. So when we're making this decision, what do we look for? What do people look for in selecting a home health care provider?
Good question, Chris. You're going to look at would I view the agency that I hire, would I view its personnel as family? Because that's what an agency needs to be. It needs to be an extension of your family. People have to actually care. You gotta, trust them. Make sure that they're certified by Medicare and Medicaid to deliver services, and also check for their accreditation. Are they accredited by the Joint Commission or the other bodies to deliver care? So at a very baseline, are these folks going to be family? Are they qualified? And are they certified and accredited to provide care and service?
Gotcha. I was going to ask you what separates you from other home health care companies.
Yes.
Along with that, I'd like to say, are you getting people? Because you and I both know people are the measure of success, right?
Yes, they are. Yes, we're getting people, we're getting patients as well as new employees. What sets us apart, Chris, I want to say our individual patient-centric care, right? So we really dive in to focus on how can we best serve a patient and their family. The patient that's in front of you is the very most important patient, and diversity and compassion. That sets us apart, my friend.
Well, I'll tell you what, people like you, they kind of draw good people to them. So,
Likewise.
Cleamon Moorer, President, CEO of American Advantage Home Care in Dearborn, Michigan. Thanks so much for joining us. But more importantly, thanks for what you're doing, bud.
Hey, my pleasure, Chris. Thank you for having me on the show.
Good to talk to you. I'm Chris
Always.
Holman. You've been watching the Michigan Business Beat on the Michigan Business Network.